So this is the slide that we all know, the HIV/AIDS cases in our South Florida region. Miami-Dade, Broward, and Palm Beach have a very high prevalence of HIV. And if you look at the percentage of these infections that are related to injection drug use, it is 11% in Miami, 11% in Broward. And as we all know, these numbers are probably way underreported, because why, when you're diagnosed with HIV, would you reveal that you are part of the most stigmatized group, even within a stigmatized group, that you inject drugs? So it's really, I think that we're underreporting the actual prevalence of infections that are related to injection drug use. Just as a side, we do have, unfortunately, in the state of Florida, vertical transmissions of HIV, and I have seen in the cases of vertical transmission at Jackson, a lot of people are people who use injection drugs and haven't had prenatal care, so it's contributing to one of our most preventable and tragic modes of transmission of HIV in the state. So everything that happens in Tallahassee affects the way that physicians and other healthcare workers, all of the tools that we have to provide the best health outcomes for our patients, the origins are in Tallahassee with the decisions that the lawmakers are making. So, for instance, I wanted to be able to give clean syringes to my patients who use drugs. That's not a very innovative idea, but in order to get the authorization to do that, I had to work through my lawmakers in Tallahassee. Otherwise, I was going to be in violation of the law. So Washington, D.C. is also, it's below the Mason-Dixon line. It's also a southern area. And it had a very similar prevalence and rates of new infections as Florida, which, we lead the pack at this time. But starting in 2007, the District of Columbia became extremely aggressive in its efforts to prevent HIV through all the methods that we know: test and treat, condoms, syringe access, PrEP. And you can see that they had decrease in transmission in all categories, but if you look at the red and the orange, they had an 80% decrease in the rate of new infections associated with injection drug use over that 4-year period. And that wasn't a fluke, because the follow-up data shows, now I believe we are red, that the infections went all the way down to 7 in 2016. So back in 2007, 149, and now 7. So this is what we can do in Florida. This is what we need to do in Florida. And but unfortunately, we have to change the law to be able to experience such drastic reductions in the rate of new infections. So the National Harm Reduction Coalition is the policy group that deals with syringe access, overdose prevention in the whole country. It's an amazing organization of harm reductionists, really progressive people who have been, it was born out of people who inject drugs, in the 80s, figuring out how to survive, how to stay alive in the midst of an epidemic. So the National Harm Reduction Conference was in Miami, and there was a presentation by our colleagues in San Francisco, which has syringe exchange for the past 30 years and distributes millions of syringes to people who inject drugs in that city. And they did a study where they looked at the prevalence of the syringes on the streets of San Francisco. And we were really interested in knowing how that compared to Miami, where we didn't have syringe exchange. So anecdotally, this big policy group, the meetings in Miami, and they chose our city. And one of the big things, the salient activities in the conference, was just mass distribution of syringes. The people who came here couldn't believe that people in South Florida had no access to clean syringes. It's really almost inhumane. The ability to protect your health and improve your health outcomes really is a human right. And they were really the state of affairs in terms of injection drug use, the state of affairs in terms of HIV in our state. It is not an understatement to say that it's like a human rights violation. Syringes on the streets of Miami was something that got people's attention. So I'm happy that I did this study. And so I did this study as my MPH capstone project. I was a medical student when I first started advocating for needle exchange in the state of Florida, and I was the common person. I am the common person. What I wanted to do was explain to lawmakers why this was an important intervention for us to have in the state of Florida. In order to have our voices heard, we have to be present. We have to go to the Capitol. We have to educate lawmakers.
Hansel Tooks.
Thank you, Mr. Chair, and the entire Appropriations Committee for... It was the first time that the students in Florida had written a resolution to the House of Delegates.
When I first heard this idea and met with Hansel, my initial reaction was, we have a very conservative legislature. It's just not something that I think will fly.
The evidence that needle exchanges prevent HIV and hepatitis is as strong as the evidence that smoking cessation prevents cancer.
You know, initially, I thought that he'll become discouraged, but that didn't happen.
My first time being a first author paper, something very interesting happened. My study was on the front page of the Miami Herald, and that rarely happens where we have the lay press taking up our health issues and putting so much focus on it. But you know, needles on the streets of Miami, it's enough to get people's attention. So that was the beginning of the movement. The resolve clause was that the Florida Medical Association would seek, not support, support is something very different, that the Florida Medical Association would seek legislation that would amend the drug paraphernalia statutes to allow syringe exchange in our state. We went to the House of Delegates and we presented, so just like in the legislature, you get referred to a committee. So we went to the Reference Committee on Legislation. They heard testimony from the students. They heard testimony from right-wing nut jobs, and in the end, the Reference Committee decided to adopt the resolution as written. They were very proud of the students for bringing this issue forward, and we were on our way. How do you pass a bill? In order to pass a bill, you have to find a bill sponsor in the House and the Senate. The bill gets filed, and then the President of the Senate and the Speaker of the House refer it to committees of reference. Now, if you are a Republican legislator who is, the Republican Party's in power in our legislature, you'll get a couple of committees of reference, which makes it easier to get to the floor. If you're from the minority party, you're more likely to get more references in order to make your job more difficult. And you have to move through each of your committees of reference sequentially before you can get to the floor. Why is that an issue? So each committee has a chair. The chair has 100% authority over the agenda of the committee. So if there is a chair of a committee who doesn't want to hear a bill, the bill is dead. And it has to get through each of its committees before it goes to the floor. After it goes through each of its committees, it has to go to the Rules Committee in each chamber, where there's something called a special order calendar that is determined. So once a bill is on special order, it goes to what's called second reading on the floor. That's when the bill can be amended. It's its first presentation to the entire body, but it has to get on the special order calendar. The Rules Committee is the Speaker designate and the incoming Senate President. Identical versions of the bill must pass both chambers, and then the bill goes to the governor, who can veto, sign, or not act. That's how a bill is passed. Not as fun as the Schoolhouse Rock. So why did the bill move that year? So each time a bill goes to a committee, it gets a bill analysis. So there's also a Department of Health analysis, which is a whole different topic, which basically said that syringe exchange might help things. It was like the most biased document I'd ever read. But the analysis in the committees, one analysis said that if we had prevented 10% of the infections in people living with HIV and AIDS in Miami with injection drug use as an associated risk, we would have saved the state $124 million in treatment costs. So ultimately, the economic argument was what sailed the bill through committees that year, and we realized that in Florida, in order to pass an unpassable bill, it ultimately comes down to dollars and cents. But we had learned a big lesson in 2014. We learned that money talks. So I was an intern at Jackson Memorial Hospital. Our research and scholarly activity is part of our work there. All of the money that comes from the federal government is administered through the state. So all of our funding in terms of our Ryan White program, the general revenue, the lawmakers are making decisions every single day that affect our practice of medicine and our ability to care for people who are both at risk for and living with HIV. So the nationwide heroin epidemic is happening. More and more people are hospitalized, overdose, endocarditis, all of these infections that come from injection drug use. And there was this wonderful young woman that I met who was a long-term person who used heroin. She was from New York City. She used to use the needle exchange programs there, get tested, take a shower. She was the victim of sexual trauma, very smart young woman. When she left New York City to come to South Florida, her last tests of the needle exchange program were negative for HIV, they were negative for hepatitis C. She came to Miami, she was infected with HIV, infected with hepatitis C, also got an epidural abscess, which is an abscess like down your spine, required multiple neurosurgery. She was on the medical service for like 3 months, and I wondered how much her hospitalization costs. But one patient's hospitalization doesn't make a paper, so I wondered how much all of these infections cost Jackson Memorial Hospital over 1 year. And you can see here on this Euler diagram, so the majority of people, this was a cohort of 349 people, the majority of the people had skin and soft tissue infections. You can see those over at the left. But once those skin and soft tissue infections progress to endocarditis, which is the kicker when the heart valve has a vegetation on it, a little bacterial vegetation that can shoot places like your spinal column, that's when the overwhelming cost was acquired. So there was a real opportunity for early intervention. It's a very perilous time right now. We don't have the most progressive federal government. We have not had a progressive state government in a long time. It's a very perilous time for our patients who are living with HIV and AIDS, and we have to be ever present in the Capitol, both Tallahassee and DC, to make sure that we are continuing to advocate, to make sure that we're able to continue to give the best care that we can and not lose any ground that we've made since the beginning of the epidemic. And the total cost to Jackson in 1 year was $11.4 million. So we scrambled to get this paper published, got this paper published much quicker, and we were ready for the next legislative session. It's really important to have, in addition to grassroots, I see a lot of activists in this room. It's important to have some Tallahassee muscle, some good old lobbyists, because in the end that might be necessary. A lot of those people who had some of the most grotesque responses when I first went to Tallahassee ended up being some of my biggest allies as the bill moved forward. They were very open to learning about why needle exchange was important for Florida, especially in the context of the opioid epidemic. So what it really takes is to educate lawmakers. It's important for us all to keep on our elected officials.
So today in the Florida House, we have Dr. Hansel Tukes and FSU medical student John Dudley. Stand up, please, guys. These guys came up here to support the needle exchange bill. Dr. Tukes has been working on this bill for about 4 years, and you've probably seen him come around and knock on your office. And this is exactly what citizen activism is all about.
95 yeas, 20 nays, Mr. Speaker.
So the bill passes.
Right now, the opioid epidemic going on in Florida. The governor's opioid bill. Do you guys know the governor's bill? Here it is. So as you can tell by Senate Bill 8 and House Bill 21, these were some of the earliest filed bills. This is his signature package, and it's to limit opioid prescriptions to 3 days or 7 days if medically necessary with proper documentation. We all who are prescribers would have to complete a 2-hour training course, and it would have mandatory checking of the prescription drug monitoring program, and our state could share with other places. The appropriation on the governor's signature bill is $53 million. So how's that bill doing? Doing well. Again, in the Senate, it's passed every committee unanimously. I actually testified in appropriations saying just that. was very concerned that if we limited the supply, we would actually add gasoline to the fire and make the epidemic worse, because people are already addicted. And then, but the prescription drug monitoring database is a good thing. And so this bill currently has one more committee, and then it will obviously pass because it's the governor's signature legislation. So right now in South Florida, the opioid epidemic is at proportions that many never thought it would be. We were traditionally an area where cocaine was the drug of choice. But when we closed the pill mills in 2011, 2012, we pushed a lot of people who were already addicted to opioids to street drugs, and the cartels responded by flooding our streets with cheaper opioids. And we have this conflagration of an opioid epidemic here now, and that intersects with the infectious disease epidemic that we've never come from under. We continue to have the highest rates of HIV. We have extraordinarily high rates of hepatitis C, and all of this happened in the absence of bread and butter public health interventions. There's so much that's wrong with the system in terms of the way that we deliver HIV care in South Florida. And I don't know if it's just because of complacency with the way things are. Everybody's okay. We avoided the same number of deaths that we were experiencing in the 80s and early 90s, and have the epidemic hasn't continued to grow at the rates that it was then, but we don't deliver evidence-based care to our patients. We make things extraordinarily hard for people living with HIV, for people living with mental health issues, for people who have substance use issues. Everything here is a challenge. Somebody who doesn't have mental health or substance use issues would have a difficult time navigating the healthcare landscape that we've laid out. And we need to have tremendous reform, Medicaid expansion for our patients so that they can access care where they need to, so that they can get medications at any pharmacy. Everything that is set up in South Florida in terms of reaching a provider, getting your medications, remaining in Ryan White, it's just barrier after barrier after barrier. And I don't know why the process has been set up against the patients, and that's what we need to change.